Ever pondered why early diagnosis of autism spectrum disorder, or ASD, is crucial? Autism spectrum disorder is a developmental condition that affects an individual's social interactions, communication, and behavior. It's a spectrum disorder, meaning it affects every individual differently and to varying degrees. Some may have mild symptoms, while others may face significant challenges in their daily lives. The impact of ASD extends beyond the individual, reaching their families and communities. It can lead to struggles in school, difficulties in forming relationships, and even challenges in finding and maintaining employment. Early diagnosis of ASD is of immense importance. It enables early intervention, which can help to improve a child's development and learning. Early intervention can equip individuals with ASD with the tools they need to navigate the world around them. But what if we could predict the risk of ASD even earlier? Recent developments in ASD research might have uncovered a potential way to predict the risk of ASD. Intrigued? Researchers from the University of Fukui have made a groundbreaking discovery. Their recent study suggests that by measuring specific fatty acid metabolites in newborn blood, we could predict the risk of autism spectrum disorder, or ASD. How so, you might wonder? Well, the researchers found that higher levels of certain metabolites, specifically a compound known as 11,12-dihydroxy, were linked to increased ASD symptoms in children at 6 years old. They discovered that higher levels of this compound seemed to affect social interactions, while lower levels impacted repetitive behaviors. Now, this study presents a fascinating possibility. Imagine being able to predict the risk of ASD early on, right at birth. This could open doors to early diagnostics and interventions, potentially improving outcomes for children with ASD. It's like having a roadmap, giving us the ability to navigate and manage the journey that lies ahead. This study is a significant stride towards understanding, diagnosing, and potentially preventing ASD. But what does this mean for us? The findings of this study have far-reaching implications. Imagine a world where we could predict the likelihood of a child developing autism spectrum disorder, or ASD, right at birth. That's the potential we're looking at with this study. It's more than just early diagnosis. It's about timely intervention and support for affected children and their families. This study could also pave the way for preventive measures. By understanding the role of specific fatty acids in ASD development, we could explore strategies to regulate these compounds, potentially preventing ASD traits. It's like having a roadmap that could guide us in altering the course of ASD development. But these are early days, and there's much we don't yet understand. The findings are exploratory, and we need to tread carefully. Further rigorous research is needed to fully understand the implications and validate these initial findings. We must remember that science is a journey, not a destination. This study has opened new doors in the field of ASD research, taking us one step closer to a future where early diagnosis and intervention might become a reality. From world affairs to breaking news, your daily dose of news has you covered. Subscribe for a well-rounded news experience.